Good morning. My name is Deemantha, and I'm a research fellow at the Medical College of Wisconsin. And I would like to thank my PI, Dr. Tammy Kindle, and the organizers of the conference for giving us the opportunity to present our research on a single perioperative antibiotic can persistently alter the post-operative gut microbiome after Roux-en-Y gastric bypass. The authors have no relevant disclosures. Roux-en-Y gastric bypass significantly alters the gut microbiome and may be a mechanism for post-operative cardiovascular disease improvement. We previously published a retrospective study of patients who underwent Roux-en-Y gastric bypass documenting that perioperative intravenous clindamycin was associated with significantly increased resolution of post-operative hypertension by 58%, compared to 44% due to cefazolin at 1 year after Roux-en-Y gastric bypass, suggesting a critical role of the modified surgical gut flora. In this study, we performed a prospective perioperative antibiotic randomization at the time of Roux-en-Y gastric bypass to confirm if a single intravenous antibiotic could alter the post-surgical gastrointestinal microbial composition and support the metabolic changes described in the literature. 16 patients undergoing Roux-en-Y gastric bypass were prospectively randomized to a single perioperative antibiotic treatment arm of intravenous cefazolin, number of 8, or clindamycin, also N of 8. Stool samples were collected from 4 different time points: 2 weeks pre-op, 2 days pre-op, 2 weeks post-op, and 3 months post-op. At 2 weeks pre-op, patients started a liquid whey protein diet until surgery. After surgery, patients were on a pureed protein diet until 2 weeks post-operatively. Patients were then transitioned to a soft protein diet and then progressed to a regular texture high protein and low carbohydrate diet at 6 weeks after surgery. Stool samples were processed for genomic DNA, followed by 16S rDNA sequencing and shotgun metagenomic sequencing and analysis. Using 16S rDNA gene sequencing, we are trying to answer the question, who's there? It was used as a tool to identify discriminatory bacteria between groups. Shotgun metagenomic sequencing was used to gain a higher resolution of all the organisms present in 3 months post-op samples, where we can differentiate bacteria at the species level. Using 16S rDNA sequencing, we identified the differences between alpha diversity and beta diversity of the gut microbiome. Alpha diversity is used to determine what species are present and how many different types of species are available within one sample. Beta diversity is used to compare the microbial differences between samples. Different types of metrics in each category were used to determine the significance between the diversities. Among the 16 patients recruited for this study, there were 88% Caucasian and 88% female with a median age of 46 years old. An initial average BMI of 51 was reported among the patients. There was no statistical significance in patient demographics between the antibiotic groups. After analyzing the 16S rDNA findings of the gut microbiome changes due to the effects of the Roux-en-Y gastric bypass alone, we found that there are significantly different changes in the alpha and beta diversities, which confirms the previously published data in the literature. In our study, we first examined the effect of the gastric bypass on the gut microbiome and found different discriminatory taxa enriched in 2 weeks and 3 months post-op compared to pre-op samples. For instance, Collinsella, which was less abundant in the 2 weeks post-op group compared to pre-op, and it is associated with type 2 diabetes, hyperlipidemia, and atherosclerosis. Furthermore, erysipelas urticalis, which is associated with intestinal inflammation and the development of non-alcoholic steatohepatitis, was less abundant in post-op 3-month samples compared to pre-op. Now I would like to present the most important findings of our study, the changes in the gut microbiome after Roux-en-Y gastric bypass, depending on the type of perioperative antibiotic. There was a statistically significant difference found in alpha diversity between pre-op versus post-op 2 weeks, including evenness and Shannon's diversity index. Evenness represents how similar the abundance of the different organisms. In other words, what is the distribution of organisms? Shannon's diversity index represents how many organisms and what's their distribution together. As you can see in the cefazolin group, there is a higher distribution of organisms, which means this group is very much more diverse than the clindamycin group after 2 weeks post-op. There was a significant difference in beta diversity based on antibiotic administration at 3 months post-op compared to pre-op. The graph shows the Jacquard dissimilarity, which compares bacteria between the groups to see which bacteria shared and which are distinct. As shown in the graph, they are moved further along the axis. It's farther away from the starting point for cephalosporin group, implying a large magnitude of change. Shotgun metagenomic sequencing reveals significantly distinct gut microbiota driven by antibiotic treatment at 3 months post-op, which is shown using an NVO plot. Each ring represents one sample, and each slice represents one assembled genome. Intensity of the color represents the abundance of that genome. In order to identify which genomes are significantly distinct between samples, we ran a linear discriminant analysis effect size and found 11 discriminatory bacteria between clindamycin and cefazolin-treated patients at 3 months post-op. There was a significantly increased abundance of Lawsonibacter species in the cefazolin group, and a significantly increased abundance of Bifidobacterium was found in the clindamycin group. Bifidobacterium species are known to produce short-chain fatty acids, such as acetate and propionate, thus contributing to the short-chain fatty acids mediated health effects. Short-chain fatty acids have been reported to regulate metabolism and stabilize blood pressure through different G-protein coupled receptors, and can profoundly impact the cardiovascular system and renal sensory nerves, affecting the kidney's ability to excrete sodium and regulate blood pressure. Furthermore, a study has reported that Bifidobacterium prevents the development of endothelial dysfunction and hypertension in deoxycorticosterone or DOCA salt rats. In conclusion, we found that Roux-en-Y gastric bypass induces significant changes in the gut microbiome at 2 weeks that are maintained 3 months after surgery. A single perioperative dose of antibiotic administered at the time of Roux-en-Y gastric bypass induces unique and persisting changes to the gut microbiome that are antibiotic specific. These changes could affect the metabolic efficacy of Roux-en-Y gastric bypass when considering gut microbiome-driven mechanism of post-operative disease improvement. A significantly higher abundance of the Bifidobacterium species in the clindamycin group could be the explanation for why in our retrospective study we see a higher rate of hypertension resolution with clindamycin administration compared to cefazolin. Thank you.
Thank you, Deemantha.